Today, we are going to discuss a very interesting case of Norwood grade 4 male pattern baldness. Here we are directly showing the before and the after pictures from the top and the front of this patient. So, Mr. Nitin, he is around 34-year-old male having almost a grade 4 or a grade 5 male pattern baldness. He has taken a lot of medical treatments for this condition, but unfortunately, because of his inconsistency and other factors, his baldness kept on progressing, and he had a family history also for that, and he presented to us like this in this condition. So first thing which we do in every case is doing a trichoscopy. Here I want to show you an important thing here. This trichoscopy is made from two words. Tricho, which means hair, and scopy, whenever we are seeing a magnified image like microscopy. So whenever we are examining hairs under a lot of magnification, 50 times or 100 times, to get more information about that, that is known as trichoscopy. So this is our traditional donor area. As you can see in this picture, it is marked. It's marked with these lines, which I'm drawing again for your benefit here on the screen. This is an area which we have to identify as per our experience, and it is further divided into three parts. The central one is occipital, left and right parietal. It can further be subdivided into upper and lower parts. So now what we do is we measure thickness of hairs in different areas, whether it's occipital, left parietal, right parietal, and 10 to 20 hairs are generally examined under the magnification, and we get information about it. So when we did for this case, we found out that his average donor hair thickness was 0.069 millimeter. His terminalis to vellus ratio was good. It was more than 90%, which means 90% or more of his hairs were terminal. Every hair which is thicker than 0.06 millimeter is a terminal hair, and average thickness was quite good. Whenever we get this kind of hair, we are quite happy with this. Average density of the grafts or the follicular units in this case was 86 follicular units per centimeter square, which is again a good number. Average number of hairs per graft in this case was 2.1. Every graft can have 1 to 4 hair. In his case, it was 2.1. Average thickness 0.069. 86 follicular units per centimeter square. Now what is this CV, which you can see here? CV is coverage value. Coverage value gives a number which can vary from 0 to 15. Higher the number, better is the coverage value, and you can see in his case this was 13.18, which is very good. So his donor side is very good. Now we calculated his total donor area. This was around 145 centimeter squares in his case, and with an average density of 86 follicular units and area of 145 centimeter square, we know that he has 12,470 grafts. But that's not the end. Every patient will have 15 to 20% of the hairs in sleeping phase. This is important for you to know, because this is not the final number. So suppose 20% of his hairs are in sleeping phase, which means another 2,500 grafts are there. So he has approximately 15,000 grafts of follicular unit in his donor area, which is a very good number. The next thing is to design the hairline and to draw the area which we have to cover. This is extremely important because this hairline will create a natural frame for the face, and this hairline has to be age appropriate. We can't make this as per our own beliefs. So here some important points to remember are, these are the eyebrows. You can see these are the eyebrows I'm marking, and this is the midpoint of the eyebrow. This is known as glabella. This point or the midpoint of the hairline is mid-anterior point or the mid-frontal point. So this MAP or the mid-anterior point can be 7 to 10 centimeter from the glabella. 7 to 10 centimeter. Now what decides whether this is 7 or 8 or 8.5 or 10? It is the age, the grade of baldness, his previous hairline. Some people are born with a broad hair also. So all these factors make us decide where we should do it. Then we have different rules also. There is a 1/3 rule where from the tip of the nose to the chin, this distance should equal to this distance, and whatever is this calculation, we further measure it and put it here. Other way is to tilt the hair hair like this, put a scale over here and here, horizontal and vertical plane. Wherever they bisect, that is the mid-anterior point. So it comes with experience of the doctor, and this is how we design it. We have to always design a hairline keeping in mind that in future he can have hair loss and his age is going to increase. Age is never going to reverse. So a person who is coming in his 40 wants a hairline of 20s, we can make him understand this is not correct. Also, this hairline is not straight. There are micro and macro irregularities in this hairline. So this is very, very important for you to understand that hairline should never be straight except for some ethnicities only. Now coming to another important point, how many grafts are needed? What people do generally is they will just, the clinics, sometimes some clinics or doctors will just give you a random number. Oh, you need 2,500 grafts, you need 3,000 grafts. No, what we have to do, we have to measure this area in square centimeters, and we have a video on our channel which shows how we exactly plan this. So you can click that video on the link given above to know your number of grafts. Now this is bifurcated into two parts, a frontal part and the mid-scalp. Hairline and the mid-scalp. The frontal part and the mid-scalp part. So the front in this case, this one is around 46 centimeter square. 46. Generally we keep a density of around 40 follicular units or grafts per centimeters in the front. So we get a number of 1840 grafts for the front, and the back end side is around 38.5 centimeter square. Here we generally give a density of 32 to 35 follicular units per centimeter square. So he needs 1232 grafts here. In total, this patient needs anything between 3000 to 3100 grafts. Here I want to tell you about our PeekAI feature in Saraswat Hospital App. This gives you a realistic AI transformation. Friends, there are a lot of AI things you will see right now, but they are not trained on real people. This one is trained on real hair transplant data, and you just have to download the app, click on the PeekAI feature, upload your front and top images, and you will receive your preliminary results within a day or two. Every result is reviewed by our ABHRS certified hair transplant doctors. There is a simple questionnaire. It also tells you about the approximate number of grafts you need, your costing if you want to plan that with us, and some other questions which should be asking your hair transplant doctor. Now let us see how the actual surgery is done and how much time it takes. There are various steps of actual hair transplant procedure. The first one is to give local anesthesia. Then after the local anesthesia and Tucens is injected, we make the slits. This is very important because in this point we have to take care of the angle, direction and density. These are the 3 points which we have to take care during this step. So extremely crucial. Whichever way the angle or direction the slit is made, the grafts are going to come out like this. Sometimes you will see that there are weird angles of some hair transplant patients which we see. This is because the slit making was not done properly. Then extraction part. Generally for a 3000 graft, it takes us around 2 hours to do the extraction and the collection of the grafts. Then at the back end, the grafts are sorted into 1, 2, 3, 4 hair grafts, and then few breaks and implantation is done. Implantation can be done by forceps and the implanter pens. Generally, a 3000 graft with 2 implanters would take around 3 hours. So the total procedure time is going to be around 7 hours with a few breaks in between if everything goes fine. So this is him at 3 days when he came for the first shampoo with us. There is some swelling here which is quite normal. His donor site is healed. His grafts also look well settled. Then at this stage, we tell them how to shampoo their hairs and take care for the next week or 10 days or so. Final shampooing is done between 10 to 12 days where all these scabs are removed. This is him at 2.5 months. This is the shedding phase. You can see here that wherever the transplant was done, it looks a bit empty because these hairs have fallen off. So this is also known as ugly duckling phase. People are often worried in this phase that what's going to happen, where have all my hairs gone? So friends, do not panic in this stage because this is a normal phenomena which has happened with you. Now at 4 months, you can see that those areas which were looking a bit thinned out, there is actually some growth here. It's not as empty as it was looking at the time of 2.5 months. So some hairs have grown here. Now at 5 months, more density is added here. And at 7 months, you can see that there is a very, very good growth on all the transplanted areas here. And you can see the hairline. Hairline is irregular and soft as well. We will see how it looks in the combing video. So that's how it is looking. Now let us see the combing video. So this is the combing video, and here you can see the kind of, what I want to emphasize here at this point is the naturalness of the hairline. See? Had it been a straight line, it would have looked like this. And that's not how our natural hairline is. It is looking quite natural here with all these irregularities which you can see. And it's a bit soft also. You can see this ½ centimeter. This is a bit soft. That's how the natural hairline should look like. Now we will see the donor site also, how the donor site looks like. That's how his donor site is looking on the combing. We can see that it's looking absolutely normal. Nobody can make out that the donor site is thin. So in nutshell, it's a complete restoration from a grade 4 or a 5 male pattern baldness to full hairs on the scalp looking very natural. Hair density was quite low previously, and now with the added transplanted hairs, the density is also improved. Now whether hair transplant is appropriate for you, whether it's right for you or not, it depends on a sort of a checklist which we have made for your benefit. Your hair loss should be progressive, which means it should be a male pattern baldness in which the transplant generally works, although there are other cases in which it may work. Then you should have a good donor hair. Sometimes we refuse a hair transplant if the donor site is not good, and that we can analyze in trichoscopy as well. You should have realistic expectation. If your expectations are like, in 2 months, doctor, my hairs are not growing, then that means you're a stressed person. You're a personality who takes stress for small things. In this patient, there is continuous release of cortisol from the body. It's a stress hormone. It leads to telogen effluvium and poor results. So if you have realistic expectation, then only you should go for a hair transplant. You should be willing to follow the post-operative or post-op care instructions. Sometimes some clinics or doctors will say, you don't need any medicines post-transplant. Why? Your hair loss is progressive. From grade 4, you can reach to grade 7 if you don't take medicines. And also, medicines are shown to give better results after the transplant. And do it for yourself. This is extremely important, that you should do hair transplant for yourself. Don't come under anybody's pressure. If you are okay with baldness or loss of hairs on the scalp, that's okay. Many people live like this. And if you want to do it for yourself, then only you should do it. Apart from this, if you want to know the cost of hair transplant, please click the link on the right side. And if you want to see some more results of grade 4 male pattern baldness with hair transplant with us, please click the link on the left hand side. Thank you.